This segment of DelmarvaLife is sponsored by For All Seasons Behavioral Health and Rape Crisis Center.
Since 1986, For All Seasons in Easton has provided mental health and rape crisis support to the Mid-Shore. For the past decade, the organization's grown from 24 employees to nearly 100. And today, For All Seasons is respected for its innovation and for creating a model of care that is unique not only for our region, but for our country. It is no coincidence that President and CEO Beth Ann Dorman is celebrating 10 years with For All Seasons. That is awesome. Congratulations.
Thank you.
How does it feel to have that under your belt?
It feels wonderful.
Yeah.
It feels great. You know, we've really come to a place where we've built an incredible team and we have just blossomed as an agency, and it feels good to do a look back.
Okay, so have you got a secret sauce to your success?
You know, we spent a good amount of time in the couple decades before I arrived at the agency struggling. And so the secret sauce is to really work together, to be able to make decisions that create sustainable partnerships and build an amazing team. I'm surrounded by incredible people every day that I go to work.
Can you name some of those that you've reached out to over the years?
Yeah, you know, we work with the governor's office on crime policy and prevention. Without the governor's funding, we would not be able to provide services to those that we work with, our sexual assault victims and mental health services. We work really closely with healthcare. We work really closely with our school systems and all of the partners where we identify gaps in services and say, how could we do this better if we do this together? And
you made it work. Okay. Your agency has become an influencer in rural mental health care. Mm-hmm. You were named Maryland's 2022 Community Star by the National Organization of State Offices of Rural Health. Okay, let's talk rural for just a second. What kind of challenges and resolutions to those challenges have you got for rural mental health?
Yeah, you know, we serve all 5 counties of the Mid-Shore, and then we have a telehealth program. And so we knew when we put in that telehealth program that it was going to help to solve the transportation issue. That's always an issue in rural communities.
Right.
Access to qualified professionals who we can hire and make sure that we have enough social workers and enough psychiatrists. That's always a challenge in a rural area. And one of the things that I have come to understand in my 10 years is that every single county that we serve is like a different state. You can't work in Dorchester County and think that the exact program that you've put in place for those constituents can just be transferred up to, say, Kent County, because they're different communities. And so one of the challenges is taking what we know as a good program and then making it what it needs to be for each of the counties that we serve.
Okay, but at the same time, you've got a center for learning.
We do.
How do you educate the greater community?
Things like this. 10 years ago, I was thinking of this on my drive down here. We never would be having this conversation 10 years ago. Talking about mental health, making sure that when we have programming that is not only training our staff, but training other providers, we are saying, let us share with you. We're taking what's happening in our community and paying attention, working with things like our first responder program to make sure that first responders are being taken care of. When we're seeing a long wait list for our veterans community, we stepped in and said, this is something that we think we can help affect change in. And then of course our open access program where we're giving services now same day. Those are the ways that we're educating the community through the Center for Learning, saying, mental health matters, and here's the solution once we've provided those trainings to say, and this is how we can help.
You have come a long ways in 10 years.
I have.
Okay. So what from here?
You know, we are going to continue to expand. Right now we're in an initiative. I believe that if we are on the main streets of every community we serve, then when folks drive into our beautiful communities, they know mental health matters. So we're expanding in Dorchester County, we're expanding in Kent County and in our Talbot County location. We've already done the expansion in our Caroline office and in our Stevensville office, and so really just making sure that we are paying attention to areas where we can bolster what we're doing. We're not reinventing the wheel. We aren't trying to duplicate what's already in place. We're working together to fill the gaps as we expand our services.
Absolutely amazing what you're doing. Beth Ann Dorman with For All Seasons, congratulations again on 10 years. We look forward to seeing you again soon.
Thanks so much.
All right. Well, stick around because there's a whole lot more coming your way too. DelmarvaLife. We'll be right back.